Well, thanks everybody for the evening, sticking around. I wanted to be part of this so bad, and they gave me a 5-minute slot. Everybody else got 15 minutes, and they all went way over, so half of you are sleeping, but I'll move quickly. I do want to also thank Kate, and I'll tell you the reason why I battered everybody, and that was my part in this whole thing, was battering you with a survey, was because the first time was 68 people, we sent it out. And then it was 119, I sent it out again. Then it was 210, so I had to send it out again. And then just the last one was 389 emails, so I sent it out again because Kate wanted everybody's opinion, and we got 210 responses. So to dive into this, 450, so vote in the back, and we'll take a moment and add you to the slide. But here's what it looks like. As far as the distribution in the responses, and actually the uniformity throughout every survey was about the same. It's about 2/3 surgeons and then 1/3 gastroenterologists. So, and I should give credit to Vivek Kal, he's not here. Him and I kind of went through all these questions and kind of came up with things together with help of the board. And we found out we wanted to know kind of the practice setting that everybody practices in. And so from an academic practice, predominantly research, we saw about 5%. But academic practices that are predominantly clinical was the majority. Private practice plus clinical almost matched that. And then private practice without research and other. And really what that means is about 72% is really kind of a research academic institution throughout everybody here. So I thought that was fairly interesting. How much your practice involves foregut, the distribution seemed to sit right around the highest proportion here, which essentially about 2/3 of you do more than 50% foregut disease. So not unexpected, but clearly shown. One of the things we wanted to ask was, have you done some kind of foregut training? And although it says, it looks more of a discrepancy than it is, it's about 50-50. People have not specific training versus specific training. We looked at the number of years in practice, few in training still, up to 15 years, and then more than 15 years, about 54%. But what that looks like is about 46% less than 15 years. So there's kind of a good distribution of years in practice and expertise. So we talked about your main institution, where you work, and we were interested in, do you train anybody? So no residents or fellows. Do you have residents only without fellows? Do you have fellowship trainees? Do you specifically train foregut specialists? And then do you not have any fellows just interested in developing a program? And really that means about 2/3 are training people. So interesting. So what is important for you that AFS achieves? And so showing this data was a little bit hard the way we asked, so I used weighted means. And so establishing a foregut specialty was fairly high. This would be on a scale probably up to about 6. Bring greater collaboration between disciplines is about 5.25. Establishing guidelines to foster specialization, about a 5. And then meetings focused on high level, just on foregut disease. That's what you guys wanted the most. Second to this, a forum to share thoughts among like-minded people. So you guys like talking to each other, and that's why you're here. So we're trying to rate your interest in what the meeting should entail. And so as far as management of GERD and surgical medical therapies for GERD, it seems like that was the most, and we labeled it fascinating for everybody. They wanted to see more about management of GERD and surgical medical therapy, and pretty much motility disorders match that. We also looked at the endoscopic and surgical bariatrics, kind of straight across the board was the yellow. And then inflammatory disorders, again, just kind of even keel on that. And then foregut neoplasia, not as much as I thought. It does spike towards 5, but then Barrett's and stuff did spike towards the end. So it seems like you want to hear about GERD, motility, and treatment of pre-malignant lesions. Your level of interest in AFS, what you're willing to do. I'll participate in any way to make it flourish. I'm very interested in participating, including committees. We'll definitely come to meetings annually, and then maybe come, but I'll support a good cause. And so you're looking at about 82% of people that will do anything to make this work. So I thought that was pretty amazing. Again, we looked at how we should prioritize education and training. We thought research and training people was very important. And so we looked at fellowship programs specific to medicine and GI. And out of 5, 4 seemed to be the predominating response. And then training modules really mirrored that, which was pretty interesting. Research grant opportunities, not so much, but really shifted towards the important side. Training and junior faculty learning groups like mentorship type things, and then endoscopic surgical simulation, you can see kind of weighted to the 4s, and then interdisciplinary fellowships, also important. So everything up there seemed to be weighted towards the important side or the brilliant, as we pose the question. AFS should get involved in making training credentialing where there's evidence to support specific criteria, and we've talked about this. The more specialized you get, the better the outcomes. And so we asked, was our current training programs and credentialing recommendations adequate? That's it. Only 14% thought what we do right now is adequate. Individual institutions should police privileging credentialing for these procedures. Still not a great response. But more of a response said about 2/3 that there's sufficient evidence to support common procedures having specific training, which is everything we've been talking about here today, but 1/3 still think that we may be adequate. What percentage of the providers in clinical practice should be FORGA for someone to really be a specialist in this area? You guys said 8%, less than 25, 25 to 50, over 50%. And then 80%. So basically 91%, you should be somewhere between 25 and 100% of your practice, mainly more than 50%. And I think that's all I got. Thank you for your time.